Working past 65, you're not alone. But that makes Medicare decisions more confusing. Do you stick with your employer coverage or switch to Medicare? In this video, I'll break down the key differences, the real-life costs, and what to watch out for so that you don't overpay, miss a deadline, or leave your spouse without coverage. Before we dive into the cost differences, there are 3 key things you need to think about. First is employer size. If your company has 20 or more employees, you can delay Medicare. But if it's under 20, Medicare becomes your primary coverage. Second is spouse coverage. If your spouse is under 65 and is on your medical plan with you, switching to Medicare might leave them needing separate coverage. And third is plan benefits. It's not just about premiums. Think about deductibles, copays, max out-of-pocket costs, and whether your favorite doctors are in-network. In many cases, Medicare can actually save you hundreds every month compared to staying on your employer plan. For example, someone like Joe. He's 65, he's working full-time, and he's paying around $400 a month for his employer health insurance. If Joe switches to a Medicare Advantage plan, his monthly costs could drop to around $185 per month. And that's real savings, up to $2,500 a year, but only if it makes sense for his household and his situation. You may want to stick with your employer plan if your employer covers most of your premium costs, you're a high earner trying to avoid Medicare IRMA surcharges, or if your spouse depends on your plan and isn't yet Medicare eligible. Consider switching if you're paying over $150 to $200 per month for your employer plan, if you want lower, more predictable out-of-pocket costs, or if you're planning to retire soon and want to avoid gaps or late penalties. There are 3 enrollment periods you don't want to miss. First is the initial enrollment period. This is a 7-month window around your 65th birthday when you can first select a plan. The special enrollment period. If you are retiring, losing, or coming off job-based insurance, this would apply to you. And third, the annual enrollment period. This is the time every fall from October 15th through December 7th for those already on Medicare to switch their plans. If your spouse is under 65 and on your plan, you'll need to look into COBRA, an ACA marketplace plan, or short-term insurance. If your employer offers retiree benefits, we'd really recommend you to compare them carefully to Medigap or Advantage plans. Retiree plans aren't always the better deal, and if you leave them, you might not be able to get back in. If you're 65 and planning to keep working, now is the time to weigh your options. The right move depends on your work situation, income, and household needs. Compare carefully and don't wait. Missing key deadlines could cost you in penalties or gaps in care. Call us, we can help.